Okay, great. We can start now. So, hello everyone. Welcome to our general dentistry webinar with Dr. Alesh today. Thank you so much for signing up, and we hope you enjoy Dr. Alesh's presentation that she has made for us today. So, during today's webinar, there will be a 45-minute presentation, and following that will be a 15-minute Q&A session where you can ask questions and Dr. Alesh will answer. So without further ado, please give a warm welcome to Dr. Alesh. And Dr. Alesh, you can begin whenever you're ready.
Okay, thank you. Okay, hello everyone. I'm really happy to be here and excited to talk to you guys, and also happy to answer any questions that you guys may have. So today we're going to talk about kind of my pathway into dentistry and what I'm doing right now in my career, the schooling that I have to go through, what is dentistry, and then obviously time for questions at the end. So my name is Dr. Alesh. My first name is Joke. I'm a general dentist in Providence, Rhode Island. And I was born and raised in Providence. I currently work in community health dentistry and private practice. I do part-time at 2 different offices. My major focus in dentistry and my reason for getting into dentistry was oral health disparities, which is difference in oral health outcomes for different groups of people based on things that like shouldn't be happening. So like due to socioeconomic status, due to race, due to gender, things like that, where people have lower or less health because of something they can't control. And so that is the reason why I went into dentistry. And that's the work that I do in dentistry to try to improve things for underserved populations. So I'm also a mom and I'm an entrepreneur. So these are the things that kind of make me me. And I'm going to go into a little bit more detail about that. So I'm a community health dentist. This is a community health center that I work at in a rural area in Rhode Island. And basically, what we do there is we provide dental services for a population that can't afford the services. So right here, I'm working on my assistant. We normally can't take pictures of our patients, but since she's my assistant, we could take a picture of her. So that's why she's in the chair. But yeah, this is what I do most of the week. So I see patients. The youngest could be 6 months to a year old, and then the oldest, we have group home patients that are like 99, 100 years old. So it just runs the whole range. And we do mostly like what we would call bread and butter dentistry, which is like fillings, root canals, extractions, dentures, the basic things that help people to have health and function in their mouth. And so I'm also a private practice dentist. So I'm in private practice 1 day a week. And in private practice, I get to do more advanced procedures. So this patient here is placing a dental implant, which is when you're missing a tooth and we replace the tooth with a titanium screw. And so these are more like advanced surgeries and more cosmetic procedures. And so I like to work in both community health and private practice because it gives me the balance in my practice of staying up to date on like basic skills and helping people where they wouldn't be able to find the help, but then also getting to do more advanced surgeries and different things, like cooler things that I can go to courses and learn about and then have somewhere to apply them. So the good thing about dentistry is you can really make your career whatever you want it to look like. You don't have to kind of pigeon your whole self into one particular thing. So I like the mix. So I'm also a mom. My daughter's 2 years old now, but this is when she was like maybe 8 months or something. And so that's my biggest reason for becoming a dentist was the type of role model that I wanted to be for whatever my future child was. And so I feel like I'm maintaining that. And so dentistry is also good if you have intentions of becoming a parent, because, once I had my daughter, I dropped down to 3 days a week. And was able to spend more time home with her. And now that she's 2, I'm back up to 5 days a week. So there's just a lot of flexibility in this career for different things that you want to do. Speaking about flexibility, I'm also an entrepreneur. So I have a wedding and event planning business that is kind of on hold right now because of COVID. But before COVID, I was doing weddings and events. And during last year, I launched a satin line scrub cap business. So you can see me here. This is our like first photo shoot for the the scrub cap line. So satin line scrub caps and bonnets. And so again, dentistry is really flexible. Like I can explore other interests that I have where I have other strengths and I have the time and ability to still pursue them. And so the schooling that I went through, high school, I went to a public high school in Providence, but it's geared towards like gifted students. So there are AP classes and different things available. And so what I would say were some good classes that prepared me mostly for like the SAT were AP Science and AP English courses. But I will say because I went to a public school, my AP classes didn't really prepare me for what I was going to experience in college. I kind of had to start from scratch in college, but it was still possible using the resources at my college. For extracurricular activities in high school, I was part of some clubs and president of a student group. I was also a cheerleader. And so I had fun in high school, and I would recommend that you guys also have fun in high school. Life is very long, and there's going to be plenty of time to kind of work hard and grind wherever you can find the opportunity to enjoy life. Please do so. I also worked during high school. I worked at CVS, which is a convenience store, a pharmacy. And then I started working in dental offices like my junior year of high school during the summertime. So it's important to see if you can find a way to either work or volunteer or intern in the career that you're looking to go into, just to make sure it is something that you want to do. But then also just having, a regular teenager job is great because you learn people skills, you learn time management, you learn money management, all these types of things I think were important to my development. So I went to Tufts University in Medford, Massachusetts for college. My majors were community health, child development, and biomedical engineering. I also did extracurricular activities. I was on the STEP team, which is pictured here. We were doing a show where we were supposed to be ballerinas. And I studied abroad in Ghana for 1 semester my junior year. And if you guys have the opportunity to study abroad when you're in college, please do so. It was a life-changing experience for me. And I applied to dental school my second year of college. So I did an 8-year early assurance program. So basically that just meant that since I applied my second year of college and I got into dental school, then I kind of knew where I was accepted, and I just had to maintain a certain GPA and get a certain score on my dental admissions test. So for dental school, I went to Tufts, which is a private dental school in Boston. There I was again involved in different extracurricular activities. So we have a student group where I was the president of the student group, and we hold different functions, mostly focused on increasing the diversity of dental students and supporting students from underrepresented backgrounds. I worked in the admissions office, and I also worked as a math tutor at the YMCA. So different ways to just use your skills. And I graduated top 10% at Tufts. And I say that to say that it's possible to do all the things that you're interested in and pursue things that make you happy while also excelling academically. Like you can have both of those things. So once I finished dental school, I had 1 year left of my master's. So I started a dual degree program at Tufts, my second year of dental school, at the medical school, doing a master's in public health. And so once I graduated, I started working part-time as a dentist and finished up my master's in 2016. And so that's it for my pathway to where I am now. But what is dentistry? So dentistry really focuses on the oral cavity, which is like the mouth and the surrounding tissues. And it's focused on prevention, restoration, and maintenance. That's how I would describe. So prevention is really we educate patients, we teach them about how to take care of their mouth and how to prevent oral disease. And diseases can be cavity, it can be decay, oral cancer. It can be, fractures of teeth, anything that is not like the normal clinically healthy version of a mouth. And then we also offer treatments to prevent those oral diseases, something like sealants or night guards or braces, which helps to prevent problems down the line. And then restoration is restoring lost form and function. So I think a lot of people think of dentists in this restoration piece, and that is okay, you broke a tooth, who are you going to call to fix it? It's going to be a dentist. You have a cavity or decay, and the dentist is going to help you remove that and fill it back up. So restoration is a big part of what we do. And then maintenance is, when you've already finished like all your treatment, just maintaining the health of your teeth, and you're coming to your dentist every 6 months for cleanings and that kind of thing. So so restoration, so that picture I showed you earlier of my assistant, so she had chipped her front tooth, and so that day I placed the two fillings on her front teeth to make them more in line with her other teeth. And so this is an example of restoring form, function, aesthetics to kind of give people a better life. So day in the life. So what I basically do, it's three things. It's patient care, which involves a whole bunch of stuff, documentation and administrative duties, which is the like writing down all the things that you did, because as a healthcare provider, it can be very litigious, meaning like people can sue you for something, or people want evidence of what happened, and so you have to really make sure you're good at your note keeping. And then team management, as the doctor, you're the one who's in charge of everything that's happening in the office, regardless if it's your responsibility or not. At the end of the day, like you're liable for everything. And so you need to manage your team. So in terms of patient care, both offices, I come in around 8:30, depending on the start time. And I go through my charts and I see what my patients are there for. I look at their x-rays, and then I introduce myself to the patient. If I've never met them before, I tell them what they're going to be getting done today. And then we start whatever treatment it is that we're going to do. And I kind of just do that over and over until the end of the day. I typically see between 12 and 18 patients a day, depending on what they're in there for. And then documentation, both of my offices, we do electronic health records. So that is on a computer, typing up what it is that you did, how much anesthetic or medication you gave to a patient, reviewing their medical history. I get referrals for if another doctor in my office wants me to do a extraction on their patient or something like that. So I go through my referrals. I get letters from other offices. So if someone goes and gets braces or gets a root canal done at another office, they'll send documentation to us to say, oh wait, this is what happened with your patient. So you kind of have to like coordinate that care. And then team management. So I have multiple assistants. There's a front desk. And so working with all of them to make sure that everything's running smoothly and all questions are answered for the day. If a patient comes late, okay, put that patient in this room, move this person over here, I'm going to do this. So just kind of like orchestrating that throughout the day. That's it.
Okay, great. Okay, that was an amazing presentation, Dr. Alesh. Thank you so much for presenting, and it was so cool getting to like learn more about you and like dentistry. And I learned some things that I really did not know at all about like dentistry and like the healthcare field and just stuff like that. So now we are going to move on to our Q&A session where you can ask questions and Dr. Lesh will answer. So you can ask questions by private messaging me here on Zoom or by raising your hand and we'll call on you.
I think I can't raise my hand because I'm host, but I have two questions for you. And by the way, thank you so much, Dr. Amash, for that wonderful presentation. But my first question is, what is the most rewarding part of your career?
So I would say being able to provide a service that people can't get. So like I was saying, I work in community health. So I know that I've worked really hard to improve my skills and my understanding of dentistry. And so there are lots of people who might be scared of the dentist, had a bad experience, and I get to come in and say like, okay, I'm gonna help you, whatever it is that you need, like we can take care of that for you. And that's really rewarding because that's the whole reason why I went into dentistry in the first place, is to like help people meet a need that they might not have been able to get met.
Yeah, thank you. And another question. Now I asked you about your rewarding part of your career, but now what are some challenges that you face performing your work?
So the biggest one I would say would be the wear and tear on your body. Like you're as much as you can try to be like ergonomically correct, it's a lot of twisting, a lot of turning, bending, trying to see, and patient after patient, it gets exhausting on the body. So you really have to try to exercise and be fit and like really work on like your back muscles. Like if I don't go to the gym and make sure like my back muscles are strong, like I feel the pain. I still do have chronic pain in my shoulder. I have to get regular massages. So like, and not like fun, relaxing massages, but like painful ones. So like it does wear and tear on your body, and you have to kind of be proactive to make sure you're keeping up with what your body needs, or else like, your career won't last as long. So that's the biggest challenge physically. And then emotionally, there's a lot of wear and tear because it's a high stress environment. A lot of patients are scared or have other things going on in their life. And it's very intimate with you being like right up on them in their mouth. And then people have expectations, and sometimes you can meet them and sometimes you can't. And that's tough because I think in some other healthcare industries, like, if you're having a surgery and it doesn't go 100% well, like people can accept that, and in dentistry, it's like, no, like this should have went 100% and it should last forever. And people don't really take into consideration the fact that, right, it depends on what you do when you get home and how you're taking care of things. And nothing in healthcare is actually 100%. So meeting people's expectations can be emotionally taxing, and just trying to get your patients to understand that you're doing the best that you can for them.
Great, thank you. I actually have another question. Jackie, is that okay?
Yeah, you could go. There's no questions here.
Okay. So you said that you're like, right up in that patient's mouth. So, I was just curious, like, how has COVID affected your job, and how you can how you can feel safe around them while performing your line of work?
So it's tough because when everything first started shutting down, it was like nerve-wracking, like, hold up, like there is no safe way to do this, people can say like wear a mask, but we can't have our patients wear a mask. Like they have to be exposed. And so when everything first shut down last March, we went to emergencies only. And so we were only seeing patients on an emergency basis, but that lowers your chance of coming into contact with someone, but it doesn't eliminate it because you're still seeing a person, right? And so we wear like our N95 masks, we had like gowns, caps, like all kinds of stuff. But at the end of the day, like you just kind of have to say, I went into this career and these are one of the risks of being a healthcare provider, is coming into contact with something that can be infectious. and something that can harm me. And that is just part of being a healthcare provider. If you want to do something where there aren't any risk of coming in something with infectious, then you can't be in direct patient contact. It's just not a thing that is possible. And so before COVID, we took every precaution in terms of like dentistry is very like, sterile instruments, and we wipe down rooms, and we wear gloves, we wear masks and all that. But I worked, the whole pandemic. I'm still working. And it's just par for the course, basically.
Thank you for answering my questions.
Okay, so I have another one that just correlates with like what Maya just asked. So so like was looking at like I guess like people's like mouths and like teeth all day like something like I guess you was something like you considered because I know a lot of people that always want to be like dentists, but they always have a fear of like because everyone's like teeth like varies. So like sometimes treatment's different and stuff like that. So like was it something that you considered, I guess? Like were you like was it one of like um I'm not sure if you get what I'm saying, but like
Not
was
yet.
it
Keep going.
was, was it something that like I guess because a lot of people think looking at like people's like teeth all day is like disgusting and it's like a pet peeve of theirs. So
Got
like,
it.
was that like one of yours? So like was that something you considered before?
So no, I'm not bothered by the mouth or teeth. Like it doesn't gross me out. I wanted to be a dentist since I was 4 years old. So it wasn't like I got thrown into it or like I didn't know what to expect. So I wanted to be a dentist since I was really, really young. And so even in middle school, like I shadowed at a dentist's office, in high school, I worked at a dental office. And so I had seen it already. And so I already knew that I was comfortable in that environment. And so I guess if it makes you uncomfortable, then this just wouldn't be the way that you would want, to go for your career. But it doesn't make me, I hate saliva though, which is weird as a dentist. But other than that, I'm fine with everything in the mouth.
Okay, yeah, okay, thank you. Okay, and then okay, we have another question from someone else. So um they asked, was triple majoring difficult?
So it wasn't, because on day one of getting to my university, I mapped out like everything I needed to graduate. So my original plan was to double major, and I only double majored because I wanted to major in community health, but they didn't offer it as a major. They only offered it as a second major. So I chose child development as the first major. And child development and community health were common double majors because some of the classes overlap. So you'll find when you get to college that you have requirements from, at least the liberal arts, you have requirements from your college. So you have to take a language, you have to take an English, you have to take a math, this many of this kind of class, whatever it is, right? And so it's all written out of what you need. But what you'll find is some classes double count. So for my community health major, if I had to take a certain class that talks about children, right? But I'm also a child development major. So I can take one class that counts for both of those. And so just being strategic in the classes that you pick and not just being like, oh, okay, I'm going to go pick my classes. Like I'll pick this one, I'll pick that one. But no, like I sat down and made like a whole sheet color coded of like, right, this will count here, this will count here. And then as a pre-dental student, you have to take 8 classes, like all your sciences and a math. And so that was classes outside of my major requirements and outside of my university requirements. And a lot of those classes counted toward the biomedical engineering degree. And so it was just more like, all right, I think out of what I would normally do, I only had to take 2 extra classes to have the biomedical engineering degree, like 2 extra classes that didn't count for anything else. So it's just like, I'm already here, I might as well just take these 2 extra classes. But other than that, I didn't like overwhelm myself in school. I still did clubs. I took summer classes to kind of make my semesters easier. I studied abroad. I still had fun in college, but I was serious about, what I came there to do. It's not necessary to triple major. It just made sense for me because it's like, all right, if I take 2 more classes, I get another degree. Like, why not? But it's definitely not necessary to do that to get to dental school or anything like that. You can major in pottery if that's an option. You can major in whatever you want as long as you take your science classes and do well in them.
Okay, and then someone else asked how many years of schooling did you have to do exactly, and was dental school challenging?
So have to do is 8. So 4 years of college, 4 years of dental school. What I did was 9 because I did my master's while I was in dental school. But if I would have did them all separate, then it would have been 10. And dental school was very challenging um, in terms of time management. Like it was a lot I had to squeeze into each and every day. So I had to be very much on a schedule, which I was in college, but intensified with the workload in dental school. But it's doable because, and we know that because there are dentists already. Like if there's something that already exists, it's not like we're reinventing the wheel and saying like, how do I become a dentist? The blueprint is there. It's just a matter of prioritizing. All right, for these 4 years, dental school is going to be my number one, priority, and I'm going to make sure that I do all the things to make me successful. And then just giving yourself the time you need to study and to practice like your hand skills once you get into clinic and patient management. Um, it's a lot, but it's very much possible to accomplish.
Okay, great. And then another question is, um, was was getting into dental school like hard, or was it how would you rate like the difficulty level? Like, was it hard to get in? Was it like easy for you?
So the issue is I didn't go in the traditional way into dental school. I went to Tufts undergrad because I knew I wanted to go to Tufts dental school. And so I applied my sophomore year of undergrad. And so I'm going up against like maybe 4 other applicants, right? Whereas when you're applying regular admission, you're going against thousands of other applicants. And so for the early assurance program, I think they reserved like 2 spots in the class for a current tough student who had like, a great GPA and looked like they were gonna be a promising possibility for Tufts dental school. And so even though that program is hard to get into, I don't think it's the same as if I was applying regular admission. I know for regular admission, you have to like you apply to way more schools. So it'd probably be like 10 or 12 schools. You have to go and interview at all of them and like fly all around and take time off of school to do that. And I didn't have that stress because I only applied to one school and I got in. So I know it is hard to get into dental school in terms of like the criteria and how many people apply versus how many people get in. But I can't speak personally on what that experience is like because I wanted to go to Tufts. I applied to Tufts. I went to Tufts, and I didn't do the whole application thing.
Okay, and then another question is, should I apply to should I try to get more than one major just in case the dental field, like the route just doesn't work for me?
So, in thinking of a major, I think the major and dentistry don't have to have anything to do with each other. I think college serves one purpose, and saying, okay, my postgraduate degree, what is it going to be, serves a completely different purpose. So, college, what you need to go there for, if you want to have a major that will give you the possibility of a career. So, you can get a major like you can do engineering or you can do computer science or something that interests you though, that you can say, if I leave at the end of these 4 years and I want to get a job, this major provides the skill set necessary for me to get that job. College is also there to prepare you for how to study and study skills. It's also there for networking. So you want to meet people, friends, and go places where you learn more, you grow, you broaden, and you also make like lasting connections that will serve you in the future. If you don't know if dental school is for sure the route you want to go, regardless of your major, still just do well in your classes. It'll give you options for what you want to do down the line. Whereas if you do poorly, then you have less options. So whatever it is that you choose something that you can enjoy, choose something that makes you employable, and choose something that you're going to do really well in and get great grades. And then you can decide, you're the one who's making the decisions. It's not someone else making the decision for you. I hope that answers the question.
Yeah, it does. Okay. And then so they're sort of going back to when you mentioned about you studying abroad and how it made a great impact on like your life.
Mhm.
And they're asking if you can explain more of your personal study abroad experience.
Okay. So I went to Ghana for 5 months. And it was at Tufts, like my first couple years, I was like very stressed out with the idea of like, okay, I need to get into dental school. I need to have great grades, like, very like laser focused on this goal. And going abroad just slowed everything down because Ghana, like, they're very like happy, easy country. Like people don't even eat on the go. Like you sit down at the table, you eat, and then you get up and you go. So it's like a completely slower pace. And it just gave me like the reset that I needed, and the energy that I needed to come back to the US and like do what I needed to do for school. So when I was in Ghana, like I really had a great time. Like I enjoyed myself. I met great friends. And I just realized like the sun rises and sets regardless. Like it doesn't matter if you have like a million papers due, if you're stressed out, if you're looking crazy, like the world moves on. So you might as well do it with like grace and happiness and some enjoyment because it's like it doesn't matter. Like the things that stress you out at the end of the day, they don't really matter that much. Like 10-page paper, oh my gosh. And then it's like it has no impact on like the world really. It's just like the way we make it so big in our brain. And so studying abroad just gave me that time to realize like the world is so much bigger than like this stress box that I was creating for myself. And yeah, that was really it. But Tufts is like well known for offering study abroad programs, and so it's very common for most juniors to go to study abroad. And so it was very easy for me at Tufts to study abroad because like there's so many different programs. When you go, they provide you a stipend, they organize everything. We stayed in like an international students dorm. Everything was just well taken care of for us. And so it made it easy to study abroad. So if you're interested in studying abroad, make sure you go to a school that has an established program because it might be harder if you have to figure it out on your own. I think that was all of the questions.
Okay, I don't see any more questions so far on my side. I'm not sure if you see any, but I don't see any direct message questions to me, so I guess we'll just wait a little.
Okay. I'll just put this up.
Okay, I have another one. So someone asked, what specific types of jobs would you suggest pre-dental students in college do for clinical experience?
So if you can work in a dental office in any capacity, that'll help you. Working in a hospital is also a great, like I did transport at a hospital. Just anything where you have to interact with patients is going to help you with your patient care. So that's in high school. In college, you want to get more focused on specific dental stuff because you want to be able to say, like, yeah, no, I really looked into this career and it's something that I want to do. Because you also don't want to, it's not just about dentistry choosing you, like dental school choosing you, but you also want to make sure you're choosing dentistry in an informed and intentional way. And so you want to make sure you're either working in a dental office, you can work in a dental lab, but I think a dental office is the easiest way to go because there's so many and a lot of them always need help. If you're just like an intern, you can become a dental assistant. Anything like that where you're working with patients in a dental office, I think would be the way to go.
Okay, and then okay, so how much did you have to pay to study abroad, and like how much did you have to pay exactly if you did?
So like I was saying, Tufts has it all kind of rolled in. So I didn't have to pay anything extra. It was my regular tuition to Tufts. And then when we got there, because the tuition at the University of Ghana is significantly lower than the tuition at Tufts University, they also gave us a stipend. So they gave us spending money each month. And they arranged our lodging, our healthcare. Like every 2 weeks, we have to go on like a cultural excursion to like a dance village. They paid for the transportation there, all the food there. And then our stipend covered like, our meals and things while we were kind of on campus and on our own. But yeah, it wasn't any extra money. The flights and everything was included.
Okay, great. Okay, so yeah, so I do not see any more questions on my side. So
Mhm.
yeah, so let's just, I guess, wait. I don't know if anyone's like typing a question or thinking of one. So we'll just give it a second.
Okay.
Okay, so if no one else has any more questions, we're just going to end it off here. So a big thank you to Dr. Alesh for taking the time to present at our webinar today and giving us the opportunity to learn a little bit more about her life and career. And I relate to your reason for deciding to enter the medical field, especially after seeing the effect health disparities that the COVID-19 pandemic caused, and also being able to see like what your day-to-day life was like. And as a dentist, like it was super interesting to see like your, I guess, your day-to-day life and routine of being a general dentist. Any document, like the documentation aspect of being like a healthcare worker was super interesting as well. And then to all the attendees, we have a feedback form that you can fill out, which I'm going to link in the chat right now. Just in case if you have another question that you didn't get to ask during the webinar, you could ask via that feedback form, or if you just want to give feedback to us, that would be greatly appreciated as well. And yeah, so if there's any questions you could ask there that you didn't get a chance to ask now, and then we will email the questions to Dr. Alesh, and when she gets back to us, we will email you back the response that she gave us. But other than that, thank you so much for coming to our webinar today, and we hope to see you in future webinars.
All right. Good luck, guys.
Thank
Thank you for
you.
having me.